Malaysia's Prime Minister Muhyiddin Yassin won't resign and says he will prove his majority in Parliament.
All visits to Singapore Hospital Awards will be stopped from Thursday as a new cluster emerges at Changi General Hospital.
And making waves in Tokyo, Chantal Liu is the first Singaporean marathon swimmer at the Olympics.
Welcome to The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
I'm Harianto Dimana. You can subscribe to the Straits Times channel so you never miss a single episode.
Just hours after at least 11 UMNO MPs withdrew their support and amid growing calls for his resignation, Malaysia Prime Minister Muhyiddin Yassin told the country today that he still commands the parliamentary majority.
In a televised national address, Mr. Muhyiddin also said the King has consented to a confidence vote when Parliament reconvenes next month. The announcement came after a morning audience with the King, who, according to Mr. Muhyiddin, only mentioned that 8 UMNO MPs had pooled their support.
Let's hear more from our Malaysia Bureau Chief, Shannon Teo, who's joining us from Kuala Lumpur. Mr. Muhyiddin has at most 104 out of 220 MPs, meaning he's 7 short of a simple majority. So, Shannon, where could the votes come from?
Well, to put it simply, there are 105 MPs in the opposition, presumably from that 105, but most of the opposition parties, most of the opposition leaders have said they've not pledged support for Muhyiddin. They don't know what he's talking about. As far as they are concerned, Muhyiddin is at 104 or less. So they want a confidence vote to happen now. If the Prime Minister is saying he still has a majority using a current tense, a present tense as it were, then let's go to Parliament now. Let's test it now. One opposition MP cheekily tweeted and saying that actually I think all the MPs are free tomorrow. Let's do it now. So nonetheless, it's only going to happen in September. We'll have to see what happens across this 1 month. At this point, I can't tell you who the Prime Minister is counting on besides the people already in his government.
So, Shannon, come September, what happens if Mr. Muhyiddin loses the confidence vote? Will that trigger an election immediately, or can a new PM be appointed based on who has the majority support in Parliament?
You're right, both things can happen. If Muhyiddin fails to prove his majority, then another MP can step forward. Another MP can try to cobble together a new government with a majority. Failing which, if there is no such candidate, it really leaves the King little choice but to go to an election. And this would be a pretty tragic outcome, given that the COVID pandemic is still raging in Malaysia. Today, we recorded a new high of cases, 19,819, just short of the 20,000 mark there. And I think in the past few days, we also hit over 200 deaths in one day. There is one other option, something that in fact even Muhyiddin's own allies have been talking about a minority government. A government that maybe doesn't have a majority, but with regards to important bills like the budget, we've been talking about revoking emergency ordinances, which led to this crisis in the first place. If whichever government is in power can get an agreement with some of the opposition parties, if it can offer some policy solutions which are amenable to some of the opposition MPs, then they could cobble together what might be known as a confidence and supply agreement. So they aren't necessarily in government, they are still in opposition. But on certain key issues where there is an agreement, where there is some overlap, then they could vote in favor of the government. That's one solution going forward. So where we are right now over the next 1 month is perhaps what Muhyiddin might be thinking about is that he can come into such an agreement with some of the opposition parties. All of them are saying that we haven't signed any declaration saying that we support the government, but maybe Muhyiddin is counting on an arrangement like this, whereby you support certain bills, certain things that we have a common agenda together, and then I can remain in power.
Well, thank you so much for sharing the latest, Shannon. We've been speaking with Malaysia Bureau Chief Shannon Teo. His reports on Mr. Muhyiddin's latest crisis can be found at straitstimes.com.
Visits to hospital wards will not be allowed for about 2 weeks from tomorrow to August the 18th. This amid the rise of community cases, including staff and patients of hospitals.
But the Health Ministry said 4 types of patient will be exempted on a conditional and case-by-case basis. They are patients who are very ill, patients who are babies or children, as well as mothers who are due to give birth or have delivered.
Patients needing additional care support from caregivers will also be exempted. Now, these 4 groups can receive 1 visitor each day for no more than 30 minutes at their bedside.
A new cluster in Changi General Hospital ward was confirmed last night, just 3 days after MOH closed the previous cluster in the hospital. The clusters are not linked. Hospital operations are running normally and patients can continue with their outpatient appointments. Patients and staff have also tested negative so far.
According to the Land Transport Authority, as at July 30th, 8 bus drivers have tested positive. Other drivers who were close contacts have been placed on quarantine or stay-home notices, but LTA said it will not affect bus operations since this group makes up less than 1% of 9,500 drivers.
Infectious disease experts also said the risk to passengers is likely to be low as drivers wear masks and have minimal interaction with those on board. 99% of bus drivers have also received their first vaccination jab.
For the wider population, as at August the 2nd, 77% have gotten at least 1 dose. Meanwhile, indicated by the orange line, 63% of the population, or 3.5 million people, are fully vaccinated. And this is 1 percentage point higher than the day before.
We're happy to welcome back Professor Teo Yik Ying to assess our current COVID-19 situation. Prof. Teo is the Dean of NUS's Swee Hock School of Public Health. Welcome back to the show, Professor. It looks like we're on track to meet our National Day vaccination goal of fully vaccinating 2/3 of the population. On the flip side, there are currently 100 active clusters as at yesterday, and the number of unlinked cases has increased in the past week. With these in mind, Professor, ahead of the task force's midpoint review, where do we stand?
Thank you very much for having me back. So actually, the number of active clusters in itself, like the number of infections reported daily, is not as worrying or as important as 6 months back. And that is because we now have about 62% of the population be fully vaccinated, and we are on track to fully vaccinate up to 80% of the population by the end of August. And what this means is that despite the relatively high number of daily reported cases, as well as the number of active clusters or even the number of unlinked cases, what we see is that this did not translate to a spike in the number of cases developing severe disease, to the point they need oxygen supplementation or ICU care. So certainly there is an increase in the number of people in the hospitals that require oxygen supplementation. And very important for us to see is that most of these people are the ones who are unvaccinated or only partially vaccinated. So what we are looking at very closely is whether some of these active clusters are happening in locations where the elderly or people with medical conditions are commonly found at. And if that happens, then we need to intervene very decisively to break the transmission chain quickly, to avoid other vulnerable individuals from being infected, especially if they remain unvaccinated. And this is exactly what we're doing with the hospitals. And we saw in the news today that all visits are temporarily ceased for the next 2 weeks, because we see that there are clusters in 2 of the large hospitals we have in Singapore. Also, I think it's highlighting that the high number of clusters or unlinked cases is actually an indirect consequence of high vaccination rates. And that is because a vaccinated person, it's more likely to be infected but may not have any symptoms. So let me say this again. A vaccinated person, when infected, is much less likely to develop any severe symptoms, or more likely will not have any symptoms at all. So this person may not even realize that he or she has been infected and continues to go about their daily activities in public. So while a vaccinated person is less contagious when infected, there is still a chance of infecting others. And this is when new transmission chains or clusters may be seeded in the community. And that is why when we see more people get vaccinated, I actually expect to see cases popping up that may be unlinked or more small clusters emerging.
Right. So, Prof, it is early August, the midpoint. Given what you've just said, are we ready for some easing, at least for those of us who are fully vaccinated?
So I actually think that Singapore is ready to ease measures, of course, in a very calibrated manner in phases. So definitely not a single once-off lifting of all restrictions like in Freedom Day, and perhaps with some differentiation in the extent of easing for those who are fully vaccinated versus those who are still unvaccinated or only partially vaccinated. So some examples could be in terms of dining in. Vaccinated people may be permitted to dine in larger groups, whereas for unvaccinated people, dining in could perhaps be permitted, but for very small group sizes, maybe even 1 or 2 people. Social and fitness activities can also be permitted in larger groups for vaccinated people. But for the unvaccinated, they may still have some restrictions. And I really want to emphasize that the reason why we need to have some differentiation is because data from Singapore as well as overseas consistently show that vaccinated people have a lower risk of being infected. And when they are indeed infected, they have a much lower risk of severe disease and complications. So those who have been vaccinated are therefore much less likely to suffer from serious illness because of COVID-19. Now, for the unvaccinated, especially the elderly and those with underlying medical conditions, they are at risk of severe disease when they're infected. And this is exactly the reason why when we start to ease our measures, we need to moderate the activities of the unvaccinated people to protect them. It is not to discriminate, it's actually to protect them. Otherwise, it would actually be irresponsible to allow them to take part in activities where we already know come with higher risk of infection and transmission.
Professor, thank you for coming on the show. It's always great to speak with you. That was Professor Teo Yik Ying, Dean of NUS's Swee Hock School of Public Health.
Looking at COVID-19 updates overseas, China reported 71 new local cases today, the highest daily number since January, as mass testing and contact tracing campaigns uncovered infections linked to the Delta variant. Nearly 500 domestic cases have been confirmed since mid-July, but most cities have yet to impose strict citywide lockdowns.
Malaysia recorded its highest daily number of cases ever, with 19,819 confirmed today. Selangor still making up the bulk of new cases, reporting over 8,300, followed by Kuala Lumpur, Kedah and Johor.
Japan's health minister signalled that the government may retract a controversial policy first announced on Monday that requires patients with less serious symptoms to isolate at home instead of going to the hospital. The new law is meant to manage a shortage of hospital beds amid a spike in Delta variant cases. But many politicians have criticized this, citing fears that it may lead to an increase in deaths.
Making history as the first ever Singaporean to swim in the 10-kilometre marathon at the Olympics, Chantal Liu crossed the finish in 23rd out of 25 swimmers. While telling reporters after, the soon-to-be 23-year-old was proud of her achievement, having defied critics who questioned her Olympic pursuit. And as our sports correspondent in Tokyo says, Liu's result today has gotten her reconsidering retirement.
She has had a lot of doubters as she pursued her Olympic dream and juggled her studies. Her coach, Marcus Chia, actually sort of alluded that this might not be the end after all. He said that, she's only 22 and most of the field today were 29 or 30, and he suggested that she could even get better with more training in the next few years. So when we asked her if Paris 2024 was a possibility, she said she would definitely consider it, but she needs to take some time off before she makes her final decision.
Frida Lim placed last out of 30 divers in the women's 10-meter platform preliminaries, where only the top 18 move on to the semi-finals. Lim scored 215.90 over 5 dives.
Only one Team Singapore athlete left at the Games. That's diver Jonathan Chan, who will be competing in the 10-meter platform on Friday. For complete coverage, visit our microsite, straitstimes.com/Tokyo Olympics.
And before we go, do take note of disruptions to several bus services on National Day due to the ceremonial parade at the Marina Bay floating platform.
Well, here are the 12 services that will be diverted on alternative routes and skip bus stops in the Marina Bay area. This will happen between 12 a.m. and 1 p.m. on August the 9th. Well, those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below.
Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on The Big Story.